So now we're going to inject the lower lid area right on the bone with some Restylane. Olga had an injection a year ago, and I think a lot of it is still present because we used a whole syringe last December. Today we're going to use definitely less than a syringe, and the remainder is going to go into the nasolabial folds. Now Olga's aware there's always a risk, a little tiny risk of a little bit of a bruise because the skin here is so thin. I'm right on the bone, and it looks like a tiny bump there, and then we just push on it and it's smoothed out. Good. This is creating a subtle but real difference, which again, most of what we gave you a year ago is still there. Keep looking up, please. Correct a little more on the side. You can see a little bit more hollowness that we're going to correct. Doesn't feel too bad, right?
No, not at all.
So we're getting to that hollowness that's right below the little fullness of fat that you have. You good? Mm-hmm. Great. So we're basically going back and forth between lower lids so that my assistant can hold pressure after the injection and again minimize the risk of bruising. There's no reason I have to be stubborn and keep treating the same lid, right, and not put pressure on areas that might be oozing a tiny bit under the skin. So anytime we see any concern that there's a bruise, we put pressure and go to the other side. Excellent. Almost done here. And again, every time I touch her with this gauze, which is clean but not sterile, I wipe her with alcohol. Really important. Tedious but necessary. Good. So on this side also we're going to fill some of the lateral, meaning the side of the lower lid, which is a bit hollow. Using a lot less product than last year because she just doesn't need as much.